If you've ever tried removing a blackhead and ended up with redness or irritation, this is for you. We've all seen those viral blackhead removal clips, the close-up extractions, the satisfying pops, but what most people don't realize is that doing it the wrong way can actually damage your skin barrier, enlarge your pores, and even leave scars. As a dermatologist, I see it all the time. Patients come in with inflamed skin thinking they were just giving themselves a deep cleanse. The truth is blackhead removal doesn't have to be painful, risky, or messy. There is a dermatologist-approved method to safely extract blackheads at home, and today I'll walk you through it step by step. You'll learn how to properly prep your pores so they open up without irritation, the safest way to extract blackheads without causing trauma, and how to prevent them from coming back in the first place. This isn't about squeezing harder or using trendy pore strips that strip away your natural oils. It's about understanding your skin, what clogs your pores, how to loosen, build up the right way, and which professional techniques actually work when done gently at home. By the end of this video, you'll know exactly how to remove blackheads the right way, no scarring, no redness, and no pain. Because healthy, clear skin isn't about harsh extractions or quick fixes. It's about using science-backed methods that protect your skin barrier while keeping your pores clean. Have you ever tried removing blackheads yourself? Comment below. Was it a success or did it end in disaster? I'd love to hear your experience before we jump into the dermatologist-approved method that actually works. Before you even think about extracting a blackhead, the most important step begins long before you touch your skin, proper preparation. This single step determines whether your extraction will leave your pores clear and healthy or red, inflamed, and potentially scarred. Think of it like trying to clean a clogged drain. If you don't loosen what's stuck inside first, you'll end up forcing it out and damaging the surface in the process. Your skin works the same way. The first step is cleansing. A gentle pH-balanced cleanser removes dirt, sunscreen, and surface oils that build up throughout the day. You'd be surprised how many people try to extract blackheads on skin that's still holding on to makeup residue or environmental grime. That residue mixes with sebum and bacteria, making extractions not only harder but riskier. A clean canvas helps minimize infection and ensures you're targeting only what's inside the pores, not everything on top of your skin. Next comes exfoliation, which is one of the most overlooked yet critical steps in the prep process. Exfoliating helps dissolve the layer of dead skin cells that can trap oils and block pores. But here's where most people go wrong. They scrub too aggressively using harsh scrubs or brushes that irritate the skin. Physical exfoliation might feel satisfying, but it often leads to microtears and sensitivity, especially right before extraction. Instead, reach for a chemical exfoliant that works gently to dissolve buildup. Products containing beta-hydroxy acids, BAs, like salicylic acid are ideal because they penetrate deep into the pores and break down the sebum and dead skin that form blackheads. Salicylic acid is particularly effective for oily or congested skin types because it's oil-soluble, meaning it can actually travel into the pore lining where the clog forms. If your skin is more sensitive, enzyme-based cleansers, often made from papaya or pineapple enzymes, can provide a similar pore refining effect without irritation. They work by breaking down dead skin cells and loosening impurities, making it much easier to clear blackheads without excessive pressure later on. Once the skin is clean and exfoliated, it's time to soften the pores. Contrary to popular belief, pores don't technically open or close, but they can be softened to make extractions smoother and safer. Applying gentle heat helps to loosen the hardened sebum inside the pores, making it more pliable and easier to remove. You can achieve this with a warm compress. Simply soak a clean towel in warm, not hot water, wring it out, and lay it over your face for about 5 to 10 minutes. This creates a spa-like effect that encourages the pores to relax and the sebum to soften. Another option is facial steaming, which many people enjoy for its relaxing benefits. Using a facial steamer or sitting over a bowl of warm water with a towel over your head allows steam to lightly penetrate the skin and promote better circulation. But here's the key: moderation. Steaming for too long or using overly hot water can dehydrate the skin and trigger redness, especially for those with rosacea or sensitive skin. 5 to 7 minutes is enough to achieve results without irritation. Prepping your skin properly doesn't just make extractions more effective, it also protects your skin barrier from trauma. When you try to remove a blackhead from unprepared skin, you're essentially forcing out hardened material through a tight opening. This not only risks incomplete removal, leaving debris behind, but can also cause the surrounding tissue to tear. Over time, repeated trauma from improper extractions can lead to enlarged pores, hyperpigmentation, and even permanent scarring. One of the most common mistakes people make is skipping prep altogether because they're in a hurry. They spot a visible blackhead, grab a mirror, and start squeezing. The problem is, that quick squeeze often only removes the surface plug while leaving the deeper part of the blockage behind. Within days, the blackhead reforms, sometimes even larger than before. Another mistake is using strong alcohol-based toners or astringents right before extraction. While these may make the skin feel clean, they actually tighten the surface and make it more difficult to remove buildup, leading to more forceful and damaging extractions. Proper preparation also sets you up for faster recovery afterward. Skin that's been cleansed, exfoliated, and softened will respond better to post-extraction treatments like calming serums or moisturizers. It helps minimize redness, ensures less inflammation, and keeps the barrier intact, which is critical for preventing new breakouts. So before you reach for your Comedone extractor or even your fingertips, take a few extra minutes to prep your skin properly. Think of it as the foundation for a safe and effective extraction routine. Cleanse gently, exfoliate smartly, and use warmth to soften the pores. These steps may seem simple, but they make all the difference between healthy, glowing skin and irritated, inflamed skin. Do you prep your skin before extractions or just go straight for it? Be honest! Drop your answer! If you've ever watched those satisfying blackhead extraction videos and thought, I can do that at home, you're not alone. But here's the truth, what looks simple on camera is actually a very controlled clinical process. Dermatologists don't just squeeze and hope for the best. Every extraction involves precision, hygiene, and patience. The goal is to remove buildup from the pore rods without injuring the skin barrier, and that comes down to technique. When dermatologists extract blackheads, the first rule is always cleanliness. The skin has already been prepped, cleansed, exfoliated, and softened, but that's only half the equation. Clean hands, sterile tools, and the right angle of pressure make all the difference. Whether using gloved fingers, wrapped in gauze, or a professional Comedone extractor, hygiene is non-negotiable. Any bacteria introduced during extraction can quickly turn a blackhead into an inflamed pimple or even a small infection. That's why if you're doing this at home, sanitize your tools with alcohol, wash your hands thoroughly, and ideally wear disposable gloves or wrap tissues around your fingertips to maintain a clean surface. And now let's talk about pressure. The most misunderstood part of extraction. Most people think more pressure means a better result, but in reality, less pressure equals more success. Dermatologists use gentle, even pressure from both sides of the pore, not a direct downward squeeze. The idea is to coax the debris out, not force it. If you press too hard, you're likely pushing the contents deeper into the skin instead of out, leading to inflammation, redness, or a painful cyst. A good extraction feels like the clog naturally slips out with minimal resistance. If you have to push harder than that, stop. That blackhead isn't ready, and forcing it will only create more harm. The angle also matters. When professionals extract, they apply pressure around the blackhead slightly beneath the plug, rather than pressing directly on top. Think of it like lifting rather than crushing. The goal is to apply gentle tension that encourages the pore to release its contents intact. With a Comedone extractor tool, the loop should be positioned so it encircles the blackhead comfortably. Apply light pressure and roll the tool across the skin instead of digging in. The rolling motion helps lift the debris smoothly while minimizing trauma to surrounding tissue. A dermatologist will also pay attention to skin response. If the area becomes too red, swollen, or starts oozing, the extraction stops immediately. At home, that same principle applies. The moment your skin starts to look inflamed, it's time to back off. Continuing to squeeze will only cause micro tears and potential scarring. Over-squeezing is one of the most common mistakes people make during DIY extractions. It not only damages the surface, but can actually enlarge the pore, making future blackheads more noticeable. Dermatologists often work under magnification and bright light to see the exact direction the blackhead sits in the pore. Since you probably don't have a clinical light or magnifier at home, using a bright, natural light source and a clear mirror helps. But even then, it's important to limit yourself. Only go after visible blackheads that seem close to the surface, the ones that appear slightly raised or darkened. If you can't see a clear plug, don't go digging. Deeper clogs or closed Comedones require professional treatment, not DIY intervention. After each successful extraction, it's essential to clean the area again. Dermatologists usually swipe the skin with an antiseptic solution or toner containing salicylic acid or witch hazel to disinfect the pore and reduce inflammation. At home, you can use a gentle, alcohol-free toner or a light layer of niacinamide serum to calm the area and tighten the pores, following up with a soothing, non-comedogenic moisturizer keeps your skin barrier protected and prevents post-extraction dryness or flaking. Another pro tip: limit how many blackheads you extract in one session. It's tempting to keep going once you start seeing results, but overdoing it leads to irritation. Professionals often limit extractions to specific areas. For example, TikTok, just the nozo in a single treatment. Spacing out your sessions allows the skin to heal and prevents unnecessary inflammation. One subtle thing you'll notice when watching dermatologists work is their pace. They're slow, deliberate, and methodical. Each movement is controlled. That's because extractions are about precision, not speed. Rushing through the process increases the risk of pushing bacteria deeper or breaking the skin. Finally, remember that not every blackhead needs to be extracted manually. Some will clear on their own with consistent exfoliation and proper skincare. The goal of at-home extractions is to handle the easy surface level one safely, not to replace professional care. If you're dealing with widespread congestion, painful bumps, or blackheads that keep refilling, it's time to see a dermatologist for a professional deep cleans. When done correctly, extractions can leave your skin looking smoother, clearer, and refreshed. But when done carelessly, they can cause lasting damage that takes months to repair. The key is clean tools, gentle technique, and patience. Would you trust yourself to do an at-home extraction now that you know the right way? Comment, Wes, or no. Right after a blackhead extraction, your skin enters a vulnerable phase. The barrier has just been disrupted, the pores are open, and your face might feel a little tender or flushed. What you do next determines whether your skin heals smoothly and stays clear, or ends up inflamed, dry, or even breaking out again. This stage is where most people make mistakes. They stop after extraction, assuming the job is done. But the truth is, post-extraction care is just as important as the extraction itself. It's all about calming, hydrating, and protecting your skin so it can recover safely and stay balanced. Immediately after extractions, the skin needs calm and hydration, not more treatment. The act of removing blackheads, even when done correctly, creates temporary micro-injuries in the skin. These are tiny openings that can easily allow bacteria to enter if not cared for properly. That's why soothing and protection come first. The goal is to reduce inflammation, restore the barrier, and prevent any post-extraction irritation or infection. Start with something gentle. Cool compresses or thermal water sprays can bring down heat and redness almost instantly. Avoid using ice directly, since extreme cold can constrict blood vessels too rapidly and cause discomfort. A soft, cooling mist or even a clean washcloth dipped in cool water can help calm the skin and tighten pores naturally. Once the skin feels soothed, it's time to replenish hydration. The best way to do this is with ingredients that attract and lock in moisture without clogging the pores. Hyaluronic acid is a dermatologist favorite for this step. It acts like a moisture magnet, drawing water into the skin and plumping up any dryness or tightness that may follow extractions. A few drops of a pure hyaluronic acid serum on damp skin can instantly restore that soft, supple feeling. Niacinamide is another powerhouse post-extraction ingredient. It's anti-inflammatory, strengthens the skin barrier and helps fade any redness or blotchiness. It also supports oil regulation, which is especially useful if you're prone to clogged pores. Applying a lightweight niacinamide serum or moisturizer helps your skin recover faster while preventing future congestion. After hydrating, seal everything in with a barrier repairing cream. Think of this step as sealing your results and protecting your skin from bacteria. Barrier creams, often formulated with ceramides, panthenol, or squalane, act like a shield, locking in moisture and blocking out external irritants. If your skin feels particularly sensitive, choose a fragrance-free formula designed for post-procedure or reactive skin. The goal here isn't to overload the skin with products, but to give it exactly what it needs to heal naturally and safely. What you don't want to do right after extraction is just as important. Avoid applying strong acids, retinoids, or exfoliants for at least 48 hours. Your skin barrier is temporarily weakened. And introducing actives too soon can trigger burning, peeling, or increased sensitivity. Even products that normally work well in your routine, like glycolic acid toners or high-strength retinol, can cause unnecessary irritation post-extraction. Think of it like treating a small cut. You wouldn't apply a harsh chemical to an open wound, and the same logic applies here. Another common mistake is over-cleansing. Some people feel like they need to keep the area clean, so they wash their face repeatedly after extraction. But excessive cleansing strips away natural oils, leaving the skin dry and more prone to inflammation. Stick to gentle cleansing twice a day using a mild, hydrating cleanser without alcohol or sulfates. Sun protection is another essential step many people overlook. Freshly extracted skin is more susceptible to UV damage and hyperpigmentation. Even mild sun exposure can cause dark spots or uneven tone to appear where extractions were done. Use a broad spectrum SPF 30 or higher, ideally one formulated for sensitive or aching-prone skin. Look for mineral sunscreens with zinc oxide or titanium dioxide. They're soothing, non-comedogenic, and ideal for post-procedure protection. You may also notice small red marks or mild swelling right after extraction. This is normal and usually subsides within a few hours to a day. To speed recovery, Avoid touching or picking at the skin. Let it heal undisturbed. Touching the face transfers oils and bacteria from your hands, which can undo all the care you just put in. If you tend to get post-extraction dryness, a thin layer of occlusive moisturizer overnight can help. Products with petrolatum dimethicone, or shea butter create a gentle film that locks in moisture and supports barrier repair. Just make sure not to overdo it. Too much occlusion can trap heat and slow healing in oily skin types. Within 24 to 48 hours, your skin should feel smoother, clearer, and calmer. That's a sign your barrier is healing properly. You'll notice that makeup applies more evenly, and your pores appear less noticeable. That's the payoff of proper aftercare, lasting clarity and balance. When you treat your skin gently after extractions, you allow it to repair itself efficiently and prevent future breakouts. Post-extraction care might not be as visually satisfying as the extraction itself, but it's the reason dermatologists can perform these procedures safely every day without damaging the skin. It's about science-backed recovery, hydration, barrier protection, and patience. The skin's natural healing ability is powerful when you support it the right way. How does your skin usually feel after blackhead removal? Calm or irritated? Comment below! When it comes to removing blackheads safely, most people think they need the latest gadget or viral skincare tool to get results. But here's the truth. Dermatologists don't rely on trendy pore vacuums or miracle devices. They rely on precision, hygiene, and patience. The right tools and products can absolutely make a difference, but only when used correctly and consistently. It's not about having a drawer full of skincare gadgets. It's about using a few dermatologist-approved essentials that actually work with your skin, not against it. Let's start with the basics, the Comedone extractor. This is one of the few professional tools that, when used properly, can safely remove blackheads without damaging your skin. It's that small stainless steel tool with a loop on one or both ends that you've probably seen in professional extraction videos. Dermatologists use it under sterile conditions and at precise angles to apply gentle pressure around the pore. At home, it's crucial to sanitize it with rubbing alcohol before and after every use. The technique matters even more. Don't press down hard or dig into your skin. Instead, place the loop around the blackhead and apply slow, even pressure until the debris releases. If it doesn't come out easily, that's your cue to stop. Forcing it only increases your risk of scarring or infection. For those who prefer a no-pressure option, hydrocolloid patches are an underrated tool. Originally used for wound healing, these small patches draw out fluid, oil, and impurities from the skin while protecting the area from bacteria. They won't remove deep blackheads, but they're excellent for calming inflammation and speeding up recovery after extractions or breakouts. Think of them as a protective bandage that helps your skin heal cleanly. Some patches now even include active ingredients like salicylic acid or niacinamide to boost their clarifying and soothing effects. Silicone cleansing brushes are another dermatologist-approved tool that's often overlooked. Unlike harsh scrubbing brushes, silicone brushes are gentle, hygienic, and effective at loosening surface debris. They provide mild exfoliation without tearing the skin, making them great for daily cleansing or prepping before extraction. The key is to use them with a gentle cleanser, not to scrub aggressively. Over-scrubbing is one of the main reasons people end up with redness and irritation. Gentle pressure and circular motions for 30-60 seconds are all you need to stimulate circulation and remove buildup. Now, when it comes to skincare ingredients that support blackhead control, there are a few that dermatologists swear by, and for good reason. Salicylic acid is the gold standard. It's oil-soluble, meaning it can actually penetrate the pore lining and dissolve the sebum and dead skin that form blackheads. Regular use of a salicylic acid cleanser or toner helps prevent clogs before they form. If you're just starting out, look for concentrations around 0.5%, 2%, enough to clear pores without excessive dryness. Clay-based products are another must-have. Clays like kaolin or bentonite act like magnets for oil and impurities, absorbing excess sebum while tightening the look of pores. A clay mask once or twice a week can keep congestion under control, especially in oily or combination areas like the T-zone. Just be careful not to overuse them. Too much clay masking can strip your skin and trigger rebound oil production. Niacinamide deserves a place in every routine. Whether you're dealing with blackheads, acne, or just dull skin, it's an anti-inflammatory vitamin that helps regulate oil production, calm redness, and strengthen your skin barrier. Think of it as the peacekeeper in your skincare lineup, balancing out stronger actives while keeping your skin hydrated and resilient. And finally, let's talk about retinoids. If salicylic acid clears out the pores, retinoids keep them clear long-term. Retinoids speed up cell turnover, helping prevent the buildup of dead cells that clog pores in the first place. Over time, they also refine texture, reduce blackhead recurrence, and improve overall tone. Start slowly, 2 or 3 nights per week, and pair them with a moisturizer to minimize dryness or irritation. Prescription strength options like adapalene or tretinoin work even more effectively under a dermatologist's supervision. Now, about those viral pore vacuums, they're popular for a reason. But they're also one of the most misused tools in skincare. While the idea of suctioning blackheads out sounds satisfying, these devices can easily cause more harm than good if used with too much pressure or on sensitive skin. They can create bruising, broken capillaries, and even skin laxity over time. Used on low settings and on well-prepped, softened skin, they can help dislodge surface oil plugs, but they're no replacement for proper exfoliation and extraction techniques. Think of them as a mild helper, not a cure-all. At the end of the day, the most effective tools for clear skin are still consistency and hygiene. A clean extractor, a simple silicone brush, and a targeted lineup of ingredients like salicylic acid, clay niacinamide, and retinoids can do far more than any flashy device. It's not about fancy gadgets, it's about precision, hygiene, and patience. When you respect your skin's limits and treat it gently, it rewards you with clarity and smoothness that lasts. What blackhead tool have you tried before? Did it work or not worth it? The real secret to clear, smooth skin isn't just about removing blackheads, it's about preventing them from coming back. Once you've gone through all the effort of prepping, extracting, and soothing your skin, the next step is maintenance. This is where most people lose progress. They clear their pores once, skip a few days of skincare, and suddenly the same blackheads start to reappear. But the truth is, prevention is simple once you understand what your pores actually need: balance, consistency, and care. Blackhead prevention is easier than blackhead correction. Consistency wins. At the core of every prevention plan is oil balance. Blackheads form when excess oil mixes with dead skin cells and gets trapped in your pores. So, controlling oil doesn't mean stripping your skin dry. It means keeping your skin hydrated enough that it naturally regulates oil production. When the skin is dehydrated, it overcompensates by producing even more sebum, which clogs pores faster. The fix: lightweight hydration. Use a non-comedogenic moisturizer daily, even if you have oily skin. Look for ingredients like hyaluronic acid, glycerin, or squalene that draw water into the skin without adding graziness. Balanced hydration keeps the pores flexible and prevents that hardened buildup that turns into blackheads. Next comes exfoliation, the key to keeping pores clear from the inside out. But exfoliation should never mean harsh scrubbing or daily acid overload. Gentle, consistent exfoliation is far more effective. Dermatologists typically recommend using a chemical exfoliant with salicylic acid or lactic acid 2 to 3 times per week. Salicylic acid is oil-soluble, which means it can actually travel into the pore lining and dissolve excess sebum before it becomes a clog. Lactic acid, on the other hand, hydrates while it exfoliates, helping maintain your skin barrier. Rotating between the two can give you the best of both worlds: clean pores and smooth, hydrated skin. A weekly deep cleansing habit is also important. Think of it as a mini facial you do at home. Once a week, use a gentle clay mask to absorb excess oil and detoxify your skin. Kaolin and bentonite clays are great options because they draw out impurities without dehydrating your skin. Apply the mask only to the areas that get congested, typically the nose, chin, or forehead instead of your entire face. Over-oozing clay masks can dry out your skin and trigger more oil production, which defeats the purpose. Follow the mask with a soothing moisturizer to restore balance. Cleansing routines also play a big role in prevention. It's tempting to use harsh cleansers that promise to deep clean or control oil, but many of them overstrip your skin. That leads to tightness, irritation, and eventually rebound oil. Stick to a pH-balanced cleanser that removes dirt and sunscreen without disrupting your barrier. If you wear makeup or heavy sunscreen, double cleansing can be a game changer. Start with a gentle oil cleanser to dissolve buildup, then follow with a water-based cleanser to finish. This method keeps your pores clear while maintaining your skin's natural moisture balance. Barrier health might be the most underrated factor in blackhead prevention. Your skin barrier, the protective layer that locks in hydration and keeps irritants out, plays a huge role in regulating oil production. When your barrier is compromised, your skin goes into defense mode, producing more sebum to protect itself. That extra oil can mix with dead cells and debris, leading straight back to blackheads. Supporting your barrier means avoiding over-exfoliation, using gentle cleansers, and incorporating ingredients like ceramides, niacinamide, and panthenol. These strengthen your skin's defenses and reduce inflammation, helping your pores function normally. Retinoids also play a key role in long-term prevention. They speed up cell turnover, which helps prevent dead cells from clogging pores. Over time, retinoids can actually make pores appear smaller because they stay cleaner and less congested. If you're new to retinoids, start slow, 2 or 3 nights a week, and pair them with a moisturizer to minimize dryness. Retinoids aren't just for acne. Talk. They're one of the most effective tools for keeping your skin smooth and even long-term. Another often overlooked habit is pillowcase hygiene. Your pillow collects oil, sweat, talk, and skincare residue every night, which transfers back to your skin as you sleep. Washing your pillowcase every few days can significantly reduce pore congestion. Talk. The same goes for phone screens and anything else that touches your face regularly. Keeping those surfaces clean makes a visible difference. Consistency is the real difference maker. Talk. You don't need a 10-step skincare routine, you just need a few effective habits you can stick with week after week. A balanced cleanser, a salicylic acid exfoliant, a weekly clay mask, talk, and a hydrating moisturizer can keep your pores clear and healthy for the long run. The skin loves routine. When you treat it gently and consistently, it rewards you with lasting clarity. Talk. Lastly, remember that pores are not flaws to erase. They're essential parts of your skin's structure. You can't shrink them permanently, talk, but you can keep them clean and healthy so they appear smaller and smoother. Focus on maintaining a calm, balanced barrier rather than chasing perfection. TikTok. Preventing blackheads is about understanding your skin's rhythm and respecting its balance. Once you find the right combination of cleansing, exfoliation, hydration, and barrier repair, talk, blackheads stop being a constant battle and become easy to manage. Do you follow a weekly pore care routine? Drop your favorite product or tip below! TikTok. If you've ever wished your skin could stay as smooth and clear as it looks right after a facial, the secret isn't constant treatments, it's consistency. Talk. Clear skin isn't a one-time event, it's a cycle. When you understand how to care for your pores step by step, you can maintain that post-facial glow right at home. The Dermatologist-Approved Blackhead removal routine follows a simple rhythm: prep, extract, soothe, and maintain. Each step builds on the last. TikTok. Creating a complete system that keeps your pores clean, your skin balanced, and your glow long-term. It all starts with preparation. Before any extraction, your skin needs to be clean, soft, and ready. Cleansing removes dirt, sunscreen, and surface oils that could mix with bacteria during extraction. Talk. A gentle exfoliant like a salicylic acid or enzyme cleanser loosens up dead skin cells and softens the material inside your pores. Then comes pore softening, using steam or a warm compress to make the sebum more pliable so it releases easily. Skipping prep is one of the main reasons people end up with redness, irritation, talk, or scarring after blackhead removal. Think of this step as your skin's warm up. The better you prep, the easier and safer the next steps become. Once your skin is prepped, talk, extraction becomes smoother and far less traumatic. The key here is control. Dermatologists apply gentle, even pressure, not force, to coax the debris out of pores. Talk. Whether using clean fingertips wrapped in tissue or a sanitized come-down extractor, the movement should be slow and deliberate. Talk. Less pressure equals more success. If a blackhead doesn't come out easily, leave it and come back to it later. Forcing it will only push debris deeper and irritate your skin. Taka. Always work with clean hands and disinfect your tools before and after. Extraction isn't about how many you can remove, it's about how carefully you can remove them. After extraction, your skin's barrier needs care and protection. This is where many people stop, and that's a big mistake. Post-extraction care is what determines how well your skin heals and how quickly it recovers. The goal is to calm inflammation, hydrate deeply, and seal in moisture. Talk. Start with a cool compress or calming mist to reduce redness, then layer on a hydrating serum with hyaluronic acid to draw moisture back into the skin. Niacinamide helps calm irritation and rebuild the barrier, while a ceramide-rich cream locks in hydration and shields your skin from bacteria. Avoid harsh acids or scrubs for at least 48 hours. Your skin needs time to rebuild its defenses. Think of this step as sealing your results, locking in clarity, talk, and preventing post-extraction breakouts. Once your skin has calmed, it's all about long-term maintenance, the step that keeps blackheads from returning. Talk. Dermatologists don't rely on extractions every week. They maintain results through smart prevention. The combination of oil balance, gentle exfoliation, and proper hydration keeps pores clear naturally. A pH balance cleanser twice daily, a BHA exfoliant a few times a week. Talk. And a weekly clay mask to absorb oil are the foundation of long-term clarity. Retinoids can also be added at night to boost cell turnover and minimize buildup over time. Talk. Hydration remains key throughout. Well-hydrated skin regulates oil more effectively, meaning fewer blockages and smoother texture overall. Barrier care is the quiet hero of this whole process. Talk. When your barrier is strong, it can regulate oil production, resist irritation, and recover quickly from extractions. Niacinamide, ceramides, talk, and panthenol should always have a place in your skincare routine to maintain that barrier strength. When you protect it, you protect your progress. This full at-home cycle, prep, extract, talk, soothe, maintain, mirrors what dermatologists do in office, just adjusted for safe, gentle use at home. This is how dermatologists maintain skin clarity between treatments. Talk. It's not about expensive gadgets or aggressive squeezing. It's about a routine that respects your skin's balance and natural healing ability. Once you establish this system, Talk, your pores stay cleaner for longer, your texture smooths out, and your complexion starts to glow from within. You don't need a clinic visit every week, you just need the right system. Talk. When you treat your skin with care, follow consistent steps, and give it what it needs to heal, your results build on themselves. Over time, you'll notice fewer new blackheads forming, talk less oil congestion, and a healthier, more resilient complexion overall. The best part, this isn't a quick fix, it's a lifelong strategy for clear, healthy skin. Talk. The same methods dermatologists use to restore skin in their offices are the ones you can safely follow at home with patients' hygiene and the right products. Talk. Consistency turns skincare from a chore into a routine that protects and strengthens your skin day after day. Should I make a full dermatologist-approved blackhead care routine video next? Comment, we ask you want it!